Pediatric Nurse Practitioner Certification Review. Introduction, Certification Description. Certified Pediatric Nurse, CPN. Requirements, registered nurse license and experience. Cost, registration, $100, exam, $300 for non-members, $255 for Society of Pediatric Nurses, SPN. Requirements before certification, RN and 5-year experience. The clinical certification on this diagnosis is a focused certification based on Certified Pediatric Nurse. An individual has to be a registered nurse with experience of at least 5 years of handling children to be certified as a CPN. The candidate will also have experience of 1,800 hours handling patients with pediatric complications. The cost for application includes a registration fee of $100, which is usually non-refundable. Later follows the cost for the CPN exam, which is $300 for non-members and $255 for the Society of Pediatric Nurses, SPN. Details about certification. The Certified Pediatric Nurse exam lasts for 3 hours and contains 175 questions which are multiple choice based on the grouping as outlined in the content. A report is later generated reflecting how the individual has performed. All certification boards require a certification based on a renewal or recertification process which documents the competency level of a candidate in the practice. Certified pediatric nurses are required to recertify annually. The cost is $295, and the exam is taken at a prometric testing center. Completion of fee payment is the first requirement, and this process can be done online. Problem statement. Knowledge deficit related to certification of CPN among emergency and critical care nurses as manifested by increased rates of mortality and health issues related to pediatric patients. Knowledge gap in handling pediatric patients. Increased knowledge leads to better care, career progression, and better pay. Nurses are not knowledgeable about CPN certification due to a lack of awareness. Problem statement. Knowledge deficit related to certification of CPN among emergency and critical care nurses as manifested by increased rates of mortality and health issues related to pediatric patients. With this certification, nurses who have roles in specialty clinics and various hospitals for children have the opportunity to benefit greatly from increased compensation, career mobility, and useful knowledge for improved care provision. Scholarly article key points. The assessment and diagnosis were done to develop the apprehension of the correlation of certain situations such as the changes in the specialty RN through the certification rate and the rates evident of the patients in the healthcare units. The assessments were based on a study conducted in all healthcare units with adults and included the medical centers alongside other pediatric institutions. Certification and patient outcomes. According to the scholarly article chosen in this study, certified nurses are highly competent. The certification process requires candidates to have certain attributes, knowledge, and experience, which makes them competent to deal with pediatric patients. Certified nurses can offer evidence-based and quality care to patients, which improves patient outcomes. For instance, such nurses will keenly look into the needs of the children and prioritize them for improved care provision. Certification and leadership skills. Clinical certification enhances various skills for unit leaders to help them guide nurses in various healthcare units which eventually ensure quality delivery of healthcare. The process of certification will also help the nurses make full use of evidence-based practice to solve problems and proper management of outcomes. Conclusion. The certification chosen is the CPN, and a candidate should be a registered nurse with at least 5 years of experience and having dealt with pediatric patients for the last 24 months. The exam is made up of 175 multiple-choice questions, and it takes 3 hours to be completed. This certification is important because there is a knowledge deficit in the area of pediatric nursing as shown by the increased mortality and morbidity cases of pediatric patients. The selected scholarly article argues that certified nurses are competent as certification validates their knowledge and experience. A CPN candidate should have at least 5 years of experience as an RN, which means he or she has been practicing long enough to have the requisite skills for improved care. Leadership skills are also gained in the process. One major takeaway lesson here is that certification plays an important role in the nursing profession. Apart from career growth prospects and better remuneration opportunities, certified nurses are competent to offer improved care to patients for better patient outcomes, which is the central purpose of nursing practice.